Have you ever been in a situation where you wanted to be intimate, but your body betrayed you? It is not just uncomfortable. It comes with a heavy pressure sitting on your chest, anxiety, embarrassment, and the loop of intrusive thoughts that follow you the entire day. When intimacy turns into a burden, you almost lose the ability to enjoy your own life. All right, let us jump in. Question: how do you measure the firmness of an erection? What standards are used to diagnose erectile dysfunction? And is there a maximum firmness that women can truly feel a difference with? When it comes to erection firmness, medicine uses a fairly simple scale that is common in research. It has 4 levels, although you will see that it is still somewhat subjective. Level 1, soft, almost impossible to have intercourse. Level 2, can be inserted but not fully stable. Level 3, firm enough for intercourse and can generally maintain it most of the time. Level 4, reaches maximum firmness and stays stable for intercourse. However, this scale is only for reference. In the end, you are the one who understands best what your natural baseline firmness used to be. That is how you compare whether things are worse now or getting better. For doctors, the focus is simply whether there is enough firmness for intercourse. For patients, the expectation is often to reach the best possible state. As for whether women can perceive the difference between different levels of firmness, to be honest, there is no clear scientific evidence to conclude that. When describing your situation to a doctor, you can simply say things like, "It is still firm, but not like before," or "I can get an erection, but it is not quite at the maximum level." Descriptions like these are extremely helpful. Regarding how erectile dysfunction is assessed, you will be given a questionnaire of about 5 questions that evaluate your confidence in getting an erection and how often you achieve enough firmness for intercourse. The scoring system classifies the condition as no dysfunction, mild, moderate, or severe. In reality, every number or technical standard is only a reference point. What matters most is whether you reach a level of firmness that feels comfortable and satisfying for both you and your partner. If the answer is no, then that is the moment to sit down and look for the root of the problem. The issue can come from many directions: poor blood flow, nerve signals not responding well, hormone levels dropping, or psychological stress slowing everything down. When you share your situation honestly, your doctor will go through each factor one by one and guide you back on track. Question: a patient is being treated for depression with a medication from the selective serotonin reuptake inhibitor group and is experiencing sexual dysfunction. He wants to know how a urologist coordinates with a psychiatrist and how selective serotonin reuptake inhibitors affect intimacy. When people talk about selective serotonin reuptake inhibitors, most of them only think about improving mood. But the downside is their ability to directly affect desire, firmness, pleasure, and the time needed to reach orgasm. This is not unusual, and it is certainly not your fault. What matters even more is how you manage treatment when you have to work with multiple specialties. In medicine, it is rare that a sexual issue is purely a physical malfunction. Almost always, there is some psychological factor involved. When intimacy becomes difficult, you start worrying, and the more you worry, the harder it becomes to stay present in the moment. Eventually, your overall quality of life is pulled down with it. No one experiences sexual problems with their psychological state completely out of the picture. That is why I always encourage patients, if possible, to work with a sex therapist or a psychologist who has experience in sexual health. I know many people feel hesitant or have limited access, but this is truly an important part of the puzzle.
Regarding how doctors coordinate with one another. If I refer you to another specialty, the information is usually exchanged directly, a phone call if we know each other, or a written note if we are not in the same system. You can absolutely take the initiative and say, I would like both doctors to communicate with each other so they fully understand my situation. And do not forget, you are the center of your own medical record. You have the right to see all notes, results, and diagnoses. Most health systems have a patient portal where you can download your records or share them with another doctor. This is the fastest way to make sure everyone who treats you has a complete picture. If you receive care within the same hospital system, everything becomes even easier. For example, in the Veterans Affairs system, I can view a patient's record from other departments and communicate directly within the system. When it comes to selective serotonin reuptake inhibitors and sexuality, one thing must be acknowledged. This group of medications very easily leads to side effects involving intimacy, and the list of its effects is not short. Desire can drop noticeably. Men may have difficulty ejaculating, delayed ejaculation, or reduced firmness. Women may have a harder time reaching orgasm or may need more time than usual.
These changes often depend on the dosage. At lower doses, many people are still fine. But when the dosage increases in order to control depression more effectively, sexual problems begin to appear more clearly. This is why you must speak directly with your psychiatrist or treating doctor. They understand very well that this is a common side effect, and they can adjust the dosage, switch to another medication, or add another medication to restore balance. But if you do not say anything, there is a good chance they will not ask, and the problem will continue quietly in the background. The most important thing is this: you are the one in the driver's seat throughout your entire treatment. You speak up, you describe your symptoms, and from there, your doctor has the foundation to adjust your treatment plan appropriately. Thank you for staying with me until the end of today's session. If you find this content helpful, do not hesitate to share it with others. Someone out there might truly need this information. And go ahead and hit subscribe. Tap it now to support the channel and to make sure you do not miss future topics. As always, put yourself first. You deserve to be taken care of and to feel better every single day.